I'm Dr. Malik. Today we'll talk about an important topic. Nowadays, for the last 1 week, in the last week, we got three cases. One is 26-year-old girl, the other was a 28-year-old boy and young man, and my relative, around 35 years old young man, he had two kids, his father of two kids. They died of heart attacks. They died of heart attacks. See, I have seen them in the last moments. They were brought half an hour before they had some chest pain. They were brought to the hospital. And by the time they came, we took an ECG. We confirmed that it is heart attack. They had a sudden arrest. All the three people, we could not send them to higher center. Immediately they collapsed. Within half an hour of their chest pain, they collapsed. They could not receive proper treatment. It was within half an hour they collapsed. Massive heart attacks for all these people. Why? Why in young people we are seeing these type of heart attacks nowadays? The main reasons, see, deaths in young people. The main reason is 80:20, as always I say, 80:20. 80% lies in your diet and 20% in your exercise. Most of the young people, because they may be busy in their activity, in their regular schedule of life, and they may not concentrate, they are not doing exercise. They are not doing exercise at all. Most of them are white collar jobs. They are not doing proper exercise. That is very, very important. 20% is exercise. So at least half an hour to 45 minutes per day, at least half an hour per day, you must concentrate on exercise. Why exercise? Exercise releases endorphins in the body. And exercise causes calorie burnt. So some are burnt by exercise. Whatever calories are coming in the food, they're burnt by exercise. One more advantage. And exercise is a mandatory thing for your good blood supply to even the thinnest blood vessel in the body. Because of your physical activity, because of your exercise, you are increasing a very good blood supply to even the minor blood vessels. It increases the blood supply. That is number one. Number two, coming to the food. What are the reasons for your early heart attacks, early young age heart attacks? It is number one, diabetes. See, in young people around 25 or 30, diabetes may not manifest. Sugar may not manifest. Diabetes may not manifest. But they have hyperinsulinemia and insulin resistance. That means the insulin in them is flowing at a high range, and there is resistance to that particular insulin. You have very high flow of insulin in your blood, but the pancreas is working at its best, but still that insulin is not useful to your body. That is called insulin resistance. So hyperinsulinemia and insulin resistance. What is the reason for this? Mainly the carbohydrate intake. We are taking immense carbohydrates, heavy number of carbohydrates. Most of them are simple carbohydrate. What is a simple carbohydrate? The simple carbohydrate meaning is there is nothing. The moment it enters your stomach or your intestine, it easily gets converted to glucose. That is simple carbohydrate. There is simple carbohydrate, there is complex carbohydrate. Simple carbohydrates are very dangerous. These simple carbohydrates are found in our white rice, wheat, sugar, jaggery from sugarcane, maida, etc. So mainly our food, our snacks, they are containing this wheat, rice, maida and sugar, jaggery from sugarcane. That's, I am very specific about this. And the snacks, frequently young people are taking frequent snacks. Most of the snacks are again containing maida, rice, wheat, etc., etc. And the oils which you are taking, the oils which young people are taking are very dangerous, particularly outside oils, the outside snacks, the snacks which come from your outside hotels and shops. They are being made with mineral oils, and the oils are used repeatedly. They use the oil repeatedly, used oil again used. That is, in fact, they cause cancers, they are carcinogenic. And one more thing, they damage the intestine. We all know that there is friendly gut bacteria in the body. Gut bacteria is your intestine, your stomach, your large intestine, your small intestine, the 10 to 13 feet of intestine, which contains very useful friendly bacteria, are disturbed by these foods. Are disturbed. The friendly bacteria which are there in the body, the bacteria, the bacteria and the fungi and the bacteria, the fungi, and the viruses which are friendly to the body are there in your gut, small intestine, large intestine, stomach, etc., from mouth to anus, which are very friendly to the body, which are very useful in more than 75% of your biochemical processes in the body, are disturbed by these foods and oils, So hyperinsulinemia, insulin resistance, which come prior to diabetes. See, diabetes is a late coming thing. See, if you become diabetic at the age of 40, you are having hyperinsulinism, and insulin resistance at the age of 25. That means 10 to 20 years before itself, you are having features of diabetes. Diabetes is a late manifestation. So hyperinsulinemia, insulin resistance are there for the last 10 to 15 years before you become a diabetic. So this is called metabolic syndrome. You become obese, you have a big belly, you have hypothyroidism, you have all the features of metabolic syndrome. You have hirsutism, that is unnecessary hair for females, PCOD, that is ovaries have cysts, and infertility in males, obesity in males, all these features, hirsutism, infertility, PCOD means small cysts in the ovaries for females. All these are features of metabolic syndrome. These are all caused by your hyperinsulinemia and insulin resistance, which come prior to your diabetes, And one more thing is, these foods damage your intestinal bacterial flora. So what happens is, inflammation starts from there. See, once your intestine, the mucosa, once you have a beautiful mucous membrane is there, lining is there in the intestine, small intestine, large intestine, stomach, etc. These foods, they damage the intestinal mucosa, inside mucosa, and the bacteria are also disturbed. Useful bacteria are replaced by worst bacteria which are not useful to the body, and there starts the inflammation. This inflammation is nothing but body's reaction to the injury, and this is the reason, this inflammation is the reason for all the problems like your rheumatoid arthritis, rheumatism, your hypothyroidism, etc. All autoimmune disorders. What is autoimmune? Your body is reacting on your body. Your body is manufacturing antibodies against your body. This is autoimmune. And your immune response, that is inflammation on your own, your body is reacting on your own cells. Okay, so from here, all the small arteries which are supplying the heart, kidney, etc., small blood vessels where the blood is flowing to the terminal organs. For example, heart has got three coronary vessels, coronary blood vessels. Small clots form in the arteries. These simple carbohydrates, they increase the triglycerides, they increase the LDL, everything in the body. They increase the fats in the body. Triglycerides are increased by this simple carbs, and these get deposited in the small blood vessels. They cause blocks. They cause blocks in the blood vessels, particularly the heart blood vessels, three blood vessels which are flowing, taking blood to the heart. They have small clots. They small obstacles, small obstacles. So after for they with these triglycerides, they get accumulated in the lumen of the blood vessel, and already there are small obstacles in the blood vessel. Suddenly some small blood clot comes and obstructs. There will be a total blood loss to the heart, and there the heart attack comes. Already you have obstacles, already you have opacities in the blood vessels. So this is very important. So your diet, your intestinal bacteria, they are determining the quality of blood flow. They are the quality of blood flow, and your blood vessels, the blood vessels which are flowing, taking blood to the heart, the three blood vessels which are taking blood to the heart, already they have small obstacles, that is opacities, small opacities, and anytime any small blood clot can form there and completely obstruct the vessel. There you land in heart attacks. So please be careful about this diet, particularly diets. So gut flora, so intestinal bacteria are very important. How to replace them is very important. So first of all, and one more thing you have to say is, outside food and snacks and oils, you all know it is very dangerous, because the oil is not good. These simple carbohydrates are also snacks which contain simple carbohydrates. They are also dangerous. And smoking really damages you. Alcohol, to some extent it is okay, 1 to 2 pecks, it doesn't damage much. But smoking is really dangerous, really dangerous. It also causes the opacities in the blood vessels. There will be opacities in the blood vessels. Be very cautious about smoking. Smoking should be strictly avoided. Alcohol, to some extent it is better, 1 to 2 pecks doesn't cause much damage. And what you are supposed to avoid is wheat. Wheat should be avoided, rice should be avoided, maida should be avoided, sugar should be avoided, jaggery from sugar cane. These are the 5 things that should be avoided completely. You start avoiding right from today, because they are simple carbohydrates which are very dangerous, which make the pancreas to work more, they compress the pancreas, they make it work like anything, causing hyperinsulinism and insulin resistance. So you must give some time for the pancreas to work, and that is done by millets, quinoa, and proteins like legumes, lentils, with its cover should be all the lentils. Please try to use the cover also, don't remove the cover. That's it contains a lot of fiber. So fiber is very important. All these things, millets contain 9 to 12% fiber. Quinoa also contains 5 to 10% fiber. So millet diet, quinoa, millets should be replaced. Wheat, rice, maida, sugar, jaggery should be replaced by jaggery, particularly from sugarcane. So millets, vegetables, fruits to some extent, and quinoa is a very good diet. So breakfast millets, lunch millets, dinner quinoa, that's a very good thing. And millets also fermented millets is very good, particularly your breakfast. I am doing all these things. I am eating for the last 3 years, and I am seeing the practical benefits of this. And particularly this millets, particularly you cook in the previous night, particularly the breakfast, cook in the previous night. Next day morning, you take it with little pickle and little curd or buttermilk. That is the best breakfast you can have. Plenty of healthy bacteria to the gut. You get plenty of healthy bacteria to gut in this, particularly in this previous night, the fermented millet. So proteins, legumes, lentils, egg, non-vegetarian, liberally you can take, and fats, oils, you must be very cautious. Oils, coconut oil is very good. Ghee is very good for cooking and eating and taking, and the other one is peanut oil, that is groundnut oil, and til oil. All these things, take it only cold pressed oils. Don't take from the shops which are contained in the plastic bottles and plastic sachets. They are all containing mineral oils. Please take only cold pressed oils. So be cautious about these oils. They must be only cold pressed oils. And once in 6 months, try to check your sugar. If you are not a diabetic, not a hypertensive, okay, then at least once in 6 months or once in 3 months, check your sugar levels, your BP, and your serum lipids like cholesterol, triglycerides, etc. 6 months, once in 6 months, check your triglycerides, serum cholesterol, LDL, HDL, etc. And serum creatinine. What is serum creatinine? Serum creatinine, it tells you how your kidneys are. Serum creatinine once in 6 months is okay. So sugar, BP, serum lipids, serum creatinine once in 3 months or once in 6 months. These 4 tests are enough. But if you say that no, I am not finding time, I am in a mobile job, I can't stay at one place, please try to follow this. If not possible also, so at least the investigations you can get it done. And other thing is, if you are an young person and you have doubt about any chest pain or any uneasiness in the chest or anything, please, at least you can get the CT calcium score. Any chances of you getting heart attacks in future, any chances, how to determine? This is CT calcium score. CT is CT scan. CT calcium score, very small test, wherein the heart blood vessels, how much calcium is there, you can determine, very simple, 10 minutes. Okay, CT calcium score. If the CT calcium score is more, very simple test. CT calcium score, if it is normal, you need not worry at all. You getting a heart attack is not possible in recent future. So if the CT calcium score is high, then get a CT angiogram, not routine angiogram, simple CT angiogram. This is CT scan angiogram. Just they give a small injection and do a CT angiogram. You can see all the 3 blood vessels which are supplying the heart, how they are, how clean they are. You can easily determine by just a CT angiogram. CT calcium score is the first test. If the calcium is high, then you can go for CT angiogram. These are the things to be followed. Try to follow it. Maintain your gut health. Try to take, wherever you are, try to take good food, standard food. Try to follow this. You can